Hi everybody, I am that nursing prof and welcome to my channel. In today's video, we're going to be doing another care plan, and this patient has chronic pancreatitis. So, their medical diagnosis is the chronic pancreatitis. How do they present to us? They are a 68-year-old man. They report 10 out of 10 abdominal pain. They present with nausea and vomiting and report recent weight loss and a 53-year history of alcohol consumption. They have an NG tube placed in his right nair, which he responds is stupid and pointless. So I tried to make the most classic pancreatitis patient ever. So this is how they are. They have nausea and vomiting, they have this extreme pain, most of them have this long history of alcohol abuse, and they will have a lot of weight loss. A common intervention that we do for these patients is inserting an NG tube. So this is pretty classic. So let's jump into the care plan part of this. So a nursing diagnosis, the first one is acute pain, because I can't just ignore this 10 out of 10 pain, right? That's very significant. So of course, our first diagnosis is going to be pain. It is related to excessive stimulation of pancreatic secretions, aka the pancreatitis, and it's evidenced by the nausea, vomiting, and the abdominal pain. That's how we know. Our outcome here will be the patient will report a decreased level of pain by the end of the shift. This is a short-term goal for a chronic condition. And you note I didn't say the patient will have no pain. I said the patient will report a decreased level of pain. It is not common for people with chronic pancreatitis to go back to zero, to say, nope, zero pain, I'm good. Usually they're going to have some sort of pain. But does it need to be 10 out of 10 all the time? No, right? So we can do something to reduce that number. So what are we going to do? We're going to give morphine, which is a very common pain med we give to this patient population. So administer morphine as ordered. Our rationale is that morphine acts as a CNS depressant, which increases the patient's pain threshold. So let's say we've done that. Now we're going to evaluate. And we can say our goal was met because the patient reported a pain of 5 out of 10 by the end of the shift. So it didn't get down to 0, but we didn't expect it to get down to 0, right? But we wanted it to get less than 10. And 5 is less than 10, so there's our proof. We met our goal, so that's good. Now let's do the second one. So our second diagnosis is knowledge deficit related to the NG tube as evidenced by the patient stating it is stupid and pointless. So they don't understand why they need that NG tube and how it's helping them. So we need to address that. Just like we need to address the pain, we also need to address their education. Both are important. I did prioritize these though. So acute pain, that's obviously the priority right now. So if you think like Maslow's, like the physiological stuff is more important than the psychological stuff. So pain was our first diagnosis because it's our highest priority. But once we get this under control, then everything else kind of becomes important too. So don't forget about this stuff. It's important too. It's just not as important in the moment. So now we're ready to do some education because their pain has decreased. Their goal, our outcome statement, the patient will be able to identify the rationale for the NG tube by the end of the shift. So it shouldn't take them, more than a couple hours for them to realize what the tube is for after you do some education. So short-term goal. How are we going to do this? We're going to teach them, right? We're going to explain the rationale for the use of the tube, and the rationale is to assist the patient to cooperate with his plan of care. So by teaching him the reason for the tube, we're expecting him to cooperate with his plan of care. Because we don't want him to be like, I don't like this is stupid, and pull it out, right? We want him to keep it in. So explaining what it's for is going to help us do that. So let's say we've done it, and we can say our goal was met when the patient verbalizes understanding of the rationale for the NG tube by the end of the shift. And this is very important that we word this correctly because you can do lots of education with your patient and you can say, do you understand? And they'll go, yep. And they could be lying and they could not know what you're saying at all. So asking them like, hey, can you explain to me why we did this or what's the point of this? And if they can, making sure you document that in your evaluation, saying, yes, they do, they get it, they understand why we did this in the first place. So that was my video, quick little one on a care plan for a patient with chronic pancreatitis. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.